Okay, so here is the scenario. I want you all to read it out and note down the important points and come up with your differential diagnosis, and then, like pause the video and then do all these things. And then also come up with a management plan. Okay, just have a look at the scenario first. Okay, so I hope you pause the video now. Basically, let's just solve this. So there is a 6-year-old boy, the child is in first decade, okay? And he has insidious development of limping. Limping signifies that if a child limps, this means that the child probably has pain on that side of the limb. That is why he is limping. And when someone has pain, the way that person walks, the person walks in an antalgic gait, okay? And there is decreased hip motion, okay? So until here we see that this might be, something can be wrong. There can be, osteomyelitis can occur in this age group, or some dislocation might have occurred. There is no history of trauma. He complains of knee pain on that side also, and he walks into the office with an antalgic gait. What is an antalgic gait? It is basically the walk that a person does when he has pain in one limb. So, he basically puts weight on the other limb for a longer period of time. So the stance phase is longer on that side of the, on that leg, and in this leg which is painful, the swing phase is normal, is longer. So जैसे हम कहते हैं लंगड़ा के चलता है, that is antalgic gait. And passive motion of the hip is guarded, okay, because there is pain, so passive motion is not that occurring properly. So basically what you just saw was the age group is very important to diagnose this case, okay? So the child was less than 10-year-old. So in this disease, the child is usually in the first decade, okay? I will tell you why. And there was, of course, painful hip, okay, on one side. If I just summarize the scenario, so this was happening. So what is this? Basically, in this age, usually what happens is that, let's say that this is the femur bone. So its head is supplied by an end artery, okay? An end artery is supplying it. So during the first 10 years of life, there is a growth spurt, okay? Especially in the epiphyseal region. So this grows outward. The peripheral rim, it grows like this, let's say. And what happens is that it outgrows its end artery, okay? It outgrows its blood supply. And when it outgrows its blood supply, then this rim is going to undergo necrosis, okay? This rim undergoes necrosis. So whenever we hear the word necrosis with femur, we are like, oh my god, this is an emergency. As we have learned that even in elders, whenever there is something, we hear about avascular necrosis, we have to prevent it. But the thing is that in this case, this is not an emergency. This is a very common problem, and this is self-limiting, okay? This is an exception. This is a self-limiting condition. Why? Because usually after growing to a certain limit, it adjusts. Okay, the blood supply manages itself, and this also becomes used to the metabolism of this region, and this is going to heal on its own. So you don't have to pin it or do anything. The only thing that you're going to do in this case is reassure the parents and symptomatic management. So what is this? This is basically leg calf Perthes disease. Okay. This is known as leg calves Perthes disease. It's a very typical scenario. If someone has not discussed it, that person might not be able to diagnose it. Okay, leg calves Perthes disease. So a child must remember the age group, because the next disease is very similar to this one. Right, first decade of life. Okay, the child is always going to be in first decade of life and is going to have pain, and that limb is going to have limited motion, and so what are you going to do? Basically, when you do the x-ray, you are going to see that this femoral head is flattened. So of course, when a child comes with such symptoms, you are going to go for an x-ray to rule out other conditions. And yes, this is it. You are going to give in symptomatic management, you are going to give traction and analgesia, and you might go for physiotherapy, so that you can adjust the the range of motion of hip joint, because we already studied that the passive movement was limited. Okay, so this is the leg calves perthes disease. So this is the second scenario of our today's discussion, and I want you again to pause the video and try to solve the scenario and come up with a management plan. Note down the important points in history. Okay, so let's just break down the history. So this is a 13-year-old obese boy. The previous scenario, the child was 6-year-old. In the first decade, less than 10-year-old. Just remember that for leg perthes, it is always less than 10. So this is not leg perthes. We looked at the age and we were like, no, this child is in second decade. This is not leg perthes. Leg perthes occurs in first decade. Okay. Now, obese boy, obesity. Okay, the weight is BMI is higher, and the child has pain in the groin region, and it could be the knee, and limping, same symptoms, same limp as in the previous scenario, and the sole of the foot on the affected side points towards the other foot, and physical examination is normal for the knee but limited hip motion, same. Now when you flex the hip, the leg goes into external rotation and cannot be rotated internally. Okay, so what has happened in this case? Basically, this is a typical scenario just like the previous one. If you have not discussed it, you will not be able to diagnose it. 13-year-old boy, second decade, first point. Second point, obesity, increased weight. In younger age, already we knew that there was an end artery supplying the femoral head, and there was already an epiphyseal growth spurt, and now excessive obesity, extra weight on the bone. The epiphysis is going to slip. Okay, this has happened in this scenario. This is a case of a slipped epiphysis. So here is a photograph of, so as you can see that this is the epiphysis and this is the growth plate, which is known as the physis or metaphysis, and this is the diaphysis. So over here we can see that this epiphysis is slipping downwards. Why? Because there's a lot of weight coming from above, so this just slips downwards in such a young age. So basically we can say that it is weak in the head is weak in both extremes of age, in younger and in children and also in older adults, so it slips downward, and because of the slipping, it can lose contact with the rest of the bone. The arterial supply can be lost for this portion, and it can actually undergo complete necrosis. Okay, so basically, you can say that this slipped femoral epiphysis is actually an emergency. Okay, this is to be managed. Why have I written ER? Yeah, just remember that it's an emergency because there's a risk of necrosis, and the child will always be obese, overweight. Excessive pressure on the femoral epiphysis, and it's going to slip downward. So what are you going to do? You are basically going to do pinning of the epiphysis. You're going to pass a pin. Okay, if this is, I'll just show you an x-ray also. Let's say that this is the portion and it's slipping downwards, right? It's slipping over here because of force from above, so you're going to put pins over here so that they are forcefully in contact, and so this is going to be treated. Now one important point is, for this, the x-ray that you do is called as the frog's leg view. This is not mentioned in the book. You have to order a frog legs view for a better assessment of this slipped femoral epiphysis.